All right, thank you very much for staying with us. It's time for us to now bounce back to our guest, and we have Dr. Asore, who is now live with us, this time on telephone call. Dr. Asore, good morning, and thank you for joining us.
Good morning for having me on your show.
All right, so can you now share your thoughts with us on the topic we're discussing? Go right ahead.
Okay, thank you very much. I think my thought about the bill that was released is a thought of my same thought around every Nigerian who wants the growth of the country. If we clearly remember at the time, they said the doctors are too much in the country, and even some are going to farming and tailoring. And also, if we look further again, there was a time they said there were even too much, and we have enough to export out of the country to help other developed nations. And now, when we had that argument then, that what they were saying is not the reality of what is happening in the health sector, they felt that we were trying to cut chaos in the health sector. On this juncture, I want to also commend Honorable Johnson, who has identified that there's a problem in the health sector. But the way it's going around is anti-human and anti-labor. It means to impoverish Nigerian doctors, and it is targeted against Nigerian doctors for whatever reason I don't understand. So I commend him for identifying that there's a serious problem in the health sector, but they have to bring all the relevant players and all the relevant actors in or bring in a good bill to actually make brain drain.
Now, while commending the senator who came out with this bill, are you aware that the reports he shared is completely far from touch with the realities on ground? He is saying that we have 10,000 doctors practicing in Nigeria, while the former president of the Nigerian Medical Association, which is NMA in Geneva, said that report is completely wrong, that the total number we have in terms of medical and dental practitioners on the register of the Medical and Dental Council of Nigeria are 104,327, while those who are practicing are 56,829. Now, looking at the sharp contrast between what he released and what this president of the council released, what can you say to this? That's one. Then two, if such a person who is coming out with a fake or wrong report is not able to give us the actual number of doctors who we have in the country and those who are practicing, do you think that his proposed bill will be able to meet the challenges bedeviling this sector? It's a two-in-one question, so tackle them one after the other. You can go now. Hello, are you there, doctor? I think we lost him again.
Okay.
All right, we'll get your thoughts if we're able to establish that connection with you.
All right, so given the enumeration that Dr. John Oladapo gave earlier on, which was quite candid, because of course, not just the medical or the health sector, there are also other sectors, which are the health-related sectors that we're not even talking about.
It's broad.
It's quite broad. When you're talking about the fact that doctors are underpaid, especially when compared to international best practices abroad, then you're talking about infrastructure decay. There are no facilities, especially in the health sector, where doctors can now be able to freely have a working environment, for us to be able to allow them work as professionals. It will shock you that in most hospitals there are no sufficient beds. It will shock you that in most hospitals there are little or no equipment to be used. Most times nurses or even families of the patient have to go outside the hospitals to get equipment, especially certain things that needs to be done like syringes and all of that. It will also shock you that even the surgeons do not even have theaters that could be used for very sophisticated surgeries that needs to be done. As he said, sometimes they need to even book and rebook patients just so that they can be able to have those facilities to use. You would also find out that even in most pharmacies, there are some drugs that are not within that cannot be available within the country.
I really share your sentiment on this, and I'm going to take some tweets now. It's time for us to start, dishing out some tweets so that our viewers can see the reactions of Nigerians concerning this bill. But before I share before I share this tweet, I want to also concur with you when you're talking about there's so much decay in the health sector. You go into a hospital, you don't even have electricity. How would these
sometimes
doctors,
they even use rechargeable lamps?
I mean, how would these doctors be able to carry out their services in this kind of environment?
And you don't want them to leave.
Now, looking at the fact that doctors are not well paid. Now, those who are even paid, how much is their salary when compared to their colleagues out there, in other civilized climes? Now, what are those other benefits that they are entitled to that you don't even want to extend to them? That is even making them go on a protest.
It's more like you saying you're beating a child and you are telling the child not to cry.
I mean,
the environment is hostile. And you're telling them they shouldn't leave.
This is in accordance with what someone said in a tweet that I'm going to read out. In fact, it's as if you read the heart and mind of this individual. He's saying here that leadership, let me even quote his handle. His handle is Oluwakemi Saliu. Oluwakemi Saliu says, leadership is supposed to be an example. Of course, we understand that. Now he continues by saying, they can't be traveling abroad for medical treatment and not expect a reciprocation from medical doctors.
Can I just respond? Can I just respond to that?
That's an irony.
Can I just respond to that?
Yes.
While we're talking about the decay in the sector, a senator is coming up with a bill. First of all, not even giving us the exact data as to how many resident doctors we have. That, number one, is an idea that fails on arrival. Number one. Number two, you cannot be giving us a bill that you do not know the number of doctors. So it means that whatever needs your bill will be addressing is going to be
in fact, it will be headed for the rock.
An effort amounting to futility.
Yeah.
It's not going to amount to anything.
Yeah.
Then secondly, you are telling doctors in a country where the environment is hostile enough for them to practice, not to travel abroad. Are you also putting up a bill as a senator to restrain or even discourage politicians, public office holders from traveling abroad for medical tourism?
First and foremost,
let us even start there first.
First and foremost, we need to even ask, which of the hospital does he even access?
I am telling you, these guys do not use the hospitals in Nigeria.
So why would they be coming up with? In fact, some persons are saying that the bills coming from the National Assembly most times are against the Nigerian.
Obviously, it is cruel.
They will never come up with any bill to really address some of the excesses.
I just said
in them.
Before you read another tweet, I just said something that are they also going to put up a bill to discourage them from going abroad for medical tourism, as well as discouraging their kids from studying abroad? It's
another kettle.
Because sometimes it's hypocrisy for someone to put up a bill preventing other people from traveling abroad to seek sound education and also be able to have environment that is enabling for them to practice. But you will also go there and have these services. Your children will go there and have these services. That's hypocrisy anyway.
Now let me read this other tweet. It's coming from AIG himself. Now it says, my brother, I don't think we have database in this country. That's sad. If we do make them give us the number of children born this month, would prove on paper. That is, he's saying here that we do not have data. And of course, it goes to show that we don't have data. Because if we have data, this senator would have gone to where the data is and picked it up hook, line, and sinker.
Can I just say
something? But for the fact that's giving us wrong information, it shows that we don't have data. And if we have, as this Twitter handle has said, give us the number of children that were born this month.
I would shock you. A certain, politician once said, and I'm not going to mention the name, that in as much as it appears on paper that we have data, it will shock you that if you go critically into these things, they do not have data. What they do is they do more of projections. So most of the times, these things are projection. It is not exactly what is available out there. And okay, let's even go by what they even have there. These guys are mentally lazy to go to those kind of areas to get those information.
Josh, we are really pressed for time. If not, I would have wanted us to discuss more on that. But let me just run through some of these tweets, then we'll just talk a little about it.
All right, go ahead.
The second one says, Iboje Lucky Paul. It says, the lawmaker should first put a law in place to ensure that children of public office holders schools in Nigeria before talking about doctors. Now the second one says Oyidamola Oyeni. It says, why would government want to stop medical professionals from leaving the country? It's a question. Then the other one says, Paul Dairo, to me all the systems in Nigeria are F up. I don't want to say that word.
Yeah.
Now the other one says, I think it is abusive if the health sector is well structured. The doctors won't leave. Why stop them for a better practice?
No.
The government needs to do better. These
No.
are Nigerians sharing their views, their belly situations on this matter.
If you look at what the handle Paul Iboje Lucky said,
Yeah.
it's exactly what I just told you earlier on. These guys are hypocrites. Let's call it a spade. You cannot call a spade, a shovel. The situation right about now is that these guys know what they are doing. They are looking for ways to prevent Nigerians from enjoying quality lifestyle. It is not available here, and you expect them to die here? It's not possible. No one is preventing you from traveling abroad. You travel abroad at any time you want to. Your children travel abroad at any time they want to. So why do you prevent other people's children from doing same? It's hypocrisy.
All right, so let me just read this other tweet.
Go ahead, please.
It says Tajuddin Woye, that's his handle. He says, for me, Nigerian government should focus more on health sector to avoid losing best human resources to other countries.
It's already happening.
It looks like Nigeria is the breeding ground. They breed doctors and they let them go to practice outside the country, which is not making sense to us. All our resources, all that it takes to make these doctors sound, we don't even enjoy them. They go out there to provide their services to other citizens in other countries, which we should really, really put a stop to. We should make the environment conducive for doctors. We should pay them as and when due. If there are other benefits that they are entitled to, realistically speaking, we should give it to them. And we should also expose them to trainings, make them get used to latest equipments as far as health sector is concerned, so that they will be at par with their peers and colleagues out there in other countries.
May I quickly just respond quickly, because
All
I know
right.
we're pressed for times. You would find out that these guys are not asking for too much. These are the
mean,
basic things that are obtainable in developed society.
and within their sector.
I mean, what are they asking for? Give them wages that are competitive enough. Improve the sector by making sure that there are infrastructures, and these infrastructures are working. And these guys will do excellently well.
We have so much tweets. These people are not really relaxing.
It's a very, very
All right,
heated
all right.
topic,
So let me
of
just
course.
read this other tweet. I think we still have some more minutes. This one says, Chi Wise, that's her handle. She says, let it start with them. No public officer should travel outside the shores of the country for any medical treatment. Let's have them act what they say.
Yes.
Preach. Or, how is it being said?
You do not say what you cannot practice. So it's going to be do what you say.
Do what you say. Don't say something
practice
else.
what you preach.
Exactly. That's the word I was trying to remember. Practice what you preach. Don't
Otherwise,
say-
you'll be seen to be a hypocrite.
Yeah, exactly. So
That's
don't
it.
say something else
And
and
do
expect
something else.
to do a different thing.
Yeah.
It's just a very good place to wrap up this
Honestly.
discussion.
Very interesting
and,
topic.
It's really something we cannot, stop talking about. We should continue to, advocate for what is right as far as we are concerned, as far as we're journalists. We should say what exactly is expected of us. And we just hope that the government will listen to the plight of the citizens and come to their aid. Now we have a quote, which I'm just trying to bring out now. It says, you don't always need a plan. Sometimes you just need to breathe, trust, let go, and see what happens. I think it should be placed on the screen there so that we can really look at it. But what do you think about
Oh
that,
yeah,
Josh?
like you said,
It's on the screen now.
Yeah, like you said, you don't need a plan most times. It's not as if in its entirety you cannot have a plan.
Exactly, because I was about saying that a
Yeah.
plan guides you.
It's just like
A roadmap.
Yeah, you can call it a roadmap. It's just like putting a drainage system here.
Yeah.
So when there is flooding, what happens? Instead of having your houses misplaced or destroyed, the water flows through that pathway.
Yeah.
So a plan is just like a guide.
Yeah.
It helps you to be able to reach your
Navigate
destination
your
or
way.
navigate through your way to get to your destination. But of course, sometimes you have to go outside your plan.
If
Sometimes.
it's very
If
necessary.
it's very necessary. That's just the way it is.
All right, so that's the much we have for you on the show today. We hope you really enjoyed everything we've served you this morning, from our news updates to our newspaper review to the guest segment, and also topical issues that we've really brought before you. We hope really you enjoyed all of it. Stay tuned for another program of the same program, of course, but different guests tomorrow, same time. On same station. I remain Samuel Okata, your host on the show today. And like I've always said, in everything you do, keep watching, keep talking. iBrand Daybreak.
All right, my name is Joshua Okata. We'll see you same time tomorrow, God willing. Bye for now.